And so I'm going to talk about this management of thyroid disorders in people with thyroid eye disease and how different options or different strategies for thyroid uh, management affects eye disease. I'm just going to, yeah, so most people with thyroid eye disease have thyrotoxicosis or hyperthyroidism, but not all. And this is a recent study where they estimated that about 86% of people with thyroid eye disease have thyrotoxicosis, and 10% has hypothyroidism, and 8% will have normal thyroid function. So people with thyroid eye disease can have normal thyroid function. And there is an interesting study from Japan looking at what happened to these people who have got normal thyroid function. And what they did was they followed up these people who had thyroid eye disease and have normal thyroid function for nearly 7 years. And what they found was that many of these patients will continue to have normal thyroid function. However, 1 in 4 of these patients will develop overactive thyroid, and a few will develop underactive thyroid. And what this means is that if you have thyroid eye disease and normal thyroid function, there is a chance that you may develop overactive thyroid, and you will need to have a blood test for thyroid function at least once a year, or if you develop symptoms of thyrotoxicosis. And the other problem with these patients is that the thyroid eye disease is often missed. And this I can illustrate with this my patient Shijan. So she was really healthy, and then she started having pain and swelling on the left eye, and she went to see the GP. And she was prescribed some eye drops, antibiotic eye drops, and it went on for two to 3 months. And she didn't get better, so she came to eye emergency department and was seen by eye doctors there, and thought that she had infection. So she got several courses of antibiotics without any benefit. And then I think this went on for 5 to 6 months, and then she started losing weight. She started getting palpitations, and she started getting tremor, and then the penny dropped, and so she was found to have thyrotoxicosis and eye disease. And so, but this situation is not uncommon. So there are at least a couple of this UK survey which has shown that the thyroid eye disease is often delayed and misdiagnosed. And one of these is the TED-CT survey. This was done by Stephanie Escott, who was our research nurse. So she surveyed the members of TED-CT, and so what she found was that 58% of the patients with thyroid eye disease were given wrong diagnosis. And the commonest wrong diagnoses were conjunctivitis and allergy. And for nearly half of the people with thyroid eye disease, it took at least 6 months from the first symptoms, eye symptoms, to achieving the diagnosis of thyroid eye disease. And actually, 25% had to wait at least 1 year from the symptoms before the diagnosis was made. So that was done in 2009, and several years later, in this study, the things hasn't improved significantly. And as you can see, so this was the survey of the patients who came to several centers in the UK, and on average, half of the people with thyroid eye disease has to wait nearly 7 months before from the symptoms before they were seen in the specialist clinic. So I'll come back to this in a little bit later. So what about thyroid eye disease and hypothyroidism? As I mentioned that 1 in 10 or 10% of the people with thyroid eye disease have primary hypothyroidism, but more will develop hypothyroidism as a result of treatment of thyrotoxicosis like radioactive iodine or surgery. And the treatment of hypothyroidism is levothyroxine, and the treatment is often simple, and you need to have at least a thyroid function test at least once a year so that the dose of levothyroxine could be adjusted. So for the rest of the talk, I will talk about thyroid eye disease in the context of Graves' disease. So this is my patient with Graves' disease. As you can see, she has got goiter, has got some swelling around the eyes and prominent eyes. And sometimes in Graves' disease, you can also get skin changes, particularly in the legs. We call it pretibial myxedema. And very, very rarely you can get this curved nail, or we call it thyroid acropathy. So it's very uncommon. And so how common is thyroid eye disease in patients with Graves' disease? So this is a nice study done in Italy. And so what they did was they assessed for thyroid eye disease in all patients with Graves' disease that came to the clinic. And what they found was that 26% of the people with Graves' disease had eye disease, and 74% didn't have any eye disease. And then when they followed up these 74% of people for 18 months, 13% developed eye disease. So many of the people who didn't have thyroid eye disease at the beginning may develop eye disease in the coming months. So the question is, what can we do to prevent this development of thyroid eye disease in these people, and how can we identify Graves' disease early, because the treatment of eye disease early is really important. So this is a project supported by TED-CT and was done by TMED, which is Thyroid Eye Disease Amsterdam Declaration Group. And this study showed that giving out this thyroid eye disease early warning card helps to identify thyroid eye disease early in people with Graves' disease. So this was a pilot study which was done in Newcastle, Exeter, Edinburgh, and Cardiff. And what the study did was we gave out these credit card size cards with the symptoms of thyroid eye disease. And if the patient developed any of these symptoms, they could ring the number. And so when we were followed up for a year, 6% of the patients rang, and out of those 6, the thyroid eye disease was confirmed in half of them, and the early treatment was offered. So this thyroid eye disease early warning card is helpful. What about treatment of Graves' disease? So many of you will, or most of you will know the 3 options for treatment of Graves' disease include radioactive iodine, antithyroid drugs, and thyroid surgery. And each option has got pros and cons, and how we treat a person with Graves' disease is often the discussion between pros and cons of each treatment options. So for example, if we have a young patient who has got small children at home, radiodiene might not be feasible because you need to avoid close contact with children. And if you develop side effects from antithyroid drugs, that might not be appropriate, and so on. Recently, so in last year, the NICE guidelines published the recommendation for treatment of hyperthyroidism. And what NICE guidelines say is that offer radioactive iodine treatment as a first line treatment for Graves' disease, unless antithyroid drugs are likely to achieve remission or if it is unsuitable. And one of the conditions where the radioiodine is unsuitable is if the patient has active thyroid eye disease. So what is the relationship between radioactive iodine and thyroid eye disease? So there are lots of studies looking at this association, and I'm just showing you one of the best studies, which shows that radioiodine increases the risk of thyroid eye disease. So in this study, so this was done in Italy, so they randomized patients with thyroid eye disease into patients with Graves' disease into 3 groups. So for one group, they gave radioactive iodine. In the second group, they gave radioiodine and prednisolone, and in the third group, they gave metamizole, which is similar to carbimazole. And what they found was that people who had radioiodine had about 20% of these people develop thyroid eye disease or worsened the symptoms of thyroid eye disease they had, and which is much higher than people who were treated with antithyroid drugs. But in people who had radioiodine with prednisolone, the steroid tablet, the risk was not there. So what we can conclude from this study is that radioiodine worsens or brings about the new cases of thyroid eye disease. And the risk is particularly higher if a patient has Graves' disease for less than 5 years. And the steroids can prevent thyroid eye disease. So in the past, the doctors used to treat with higher dose of steroids for longer period. And now it's been shown that even this small dose like 15 milligrams for a short period, for example, about 6 weeks, is equally effective. So why does the radioiodine increase the risk of thyroid eye disease? And it may be due to the rise in antibodies, TSS receptor antibodies. So and this is a really good study from Peter Larberg. So they randomized the patients with Graves' disease into 3 groups. So again, one group was treated with radioiodine, second was treated with surgery, and third with antithyroid medications. And they measured the levels of TSS receptor antibodies periodically up to 5 years. And as you can see, in people who had radioiodine, there was sharp rise in antibody level up to about 18 months, and then gradually drops, the level drop, but it remains high. So in contrast, in people who had surgery and medication, the antibody level sharply decreases, and after about 18 months, it normalizes. And we know that TSS receptor antibodies plays the central role in the pathogenesis of thyroid eye disease. So this is likely to be the reason why you are at increased risk of thyroid eye disease following radioiodine. But there are few risk factors. Not all people who have radioiodine develop thyroid eye disease. And one of the important risk factors is smoking. So smoking increases the risk of thyroid eye disease, but if you also have radioiodine, it increases the risk significantly. So in this study, 1 in 4 people who have radioactive iodine treatment develop thyroid eye disease, but if you're a non-smoker, the risk is pretty small. And the other important thing is following radioiodine, many patients will develop underactive thyroid. And if you develop underactive thyroid and if you don't get treated, that is another important risk factor. And this was shown by this study where they looked at 2 groups of people. In the first group, they gave radioiodine and treated with levothyroxine if they develop underactive thyroid. In the second group, they gave radioactive iodine 2 weeks after radioiodine treatment, so to prevent any hypothyroidism. And as you can see, the people who got treatment with levothyroxine early, therefore preventing hypothyroidism, has low risks of developing thyroid eye disease. The other important thing is that if you give radioiodine treatment for people who have got active thyroid eye disease, there is significant risk of worsening of thyroid eye disease. But what about people with inactive thyroid eye disease? So is radioiodine safe in patients with inactive thyroid eye disease? So this study from Petros Peros in Newcastle tried to answer that question. And they studied 72 patients with inactive thyroid eye disease. Many of them had moderate to severe thyroid eye disease and some with optic nerve involvement, and many of them had received steroid treatment in the past, but they all had burned out thyroid eye disease. And they also gave thyroxine replacement 2 weeks after radioiodine, and they followed up for 12 months. And none of these patients got worsening of thyroid eye disease. So which seems to suggest that radioiodine is safe if you have got inactive thyroid eye disease. Unfortunately, the studies have shown is that we don't achieve really good level of thyroid function after radioiodine in the UK. So this is a big study, again, the UK study from 31 centers. And the study is to see how well the people's thyroid function is controlled after radioactive iodine. And what the study showed is that 67% of the patients who received radioiodine had hypothyroidism some stage, and 36% had hyperthyroidism. So abnormal thyroid function after radioiodine was really, really common. And about 3% of these people develop thyroid eye disease, and 16% had worsening of thyroid eye disease. So there is more work to be done to ensure that the thyroid function is well controlled after radioiodine. So just to summarize then, the people with active thyroid eye disease, we would tend to avoid radioiodine. And if we have to give radioiodine, we would give it steroid cover to prevent the risk of deterioration of thyroid eye disease. If if the patient has inactive thyroid eye disease, so we could give radioiodine without steroids, but if in doubt, we give steroids. And people with Graves' disease without any signs of thyroid eye disease, the routine prophylactic steroid is not needed. And it is really important to stop smoking and avoid hypothyroidism. And so the NICE guidelines recommend measuring thyroid function every 6 weeks, following radioiodine for at least 6 months and less frequently afterwards. So a regular thyroid function checkup is really important. What about anti-thyroid drugs? So there are 3 types of anti-thyroid drugs currently available. So carbimazole, propylthiouracil, which is also called PTU, and metamazole. So metamazole and carbimazole are very similar. Metamazole is not available in the UK, but some of the European countries use metamazole. And all these 3 drugs blocks the synthesis of thyroid hormone, and it also modulates immune response. So in turn, propylthiouracil or PTU also blocks the conversion of T4 to T3, which is the T4 is inactive hormone to T3, which is active hormone. So which one is better? So between carbimazole and propylthiouracil, carbimazole is the better drug. It is because it is more effective, it has got less side effects, and you can use less frequently, and it's much cheaper. There's only one exception, and that is in early pregnancy, where propylthiouracil is preferable because carbimazole can cause birth defects and shouldn't be used in early pregnancy. But in terms of incidence of thyroid eye disease, both are very similar. And there are 2 ways of using these antithyroid drugs. You'll have heard the titration regime and block and replacement regime. So in the titration regime, you usually start with a higher dose between 20 to 40 milligrams of carbimazole, depending upon how severe your thyrotoxicosis is, for 4 to 6 weeks, and you gradually titrate the dose to a maintenance dose, which will be about 5 to 10 milligrams. So in block and replacement regime, you use high dose of antithyroid drugs, so usually 30 to 40 milligrams. So you block your thyroid hormone production completely, and then you add thyroxine. And when we did the survey a few years ago, about 2/3 of the endocrinologists use this block and replacement regime, about 1/3 use titration. So whether you'll be treated with block and replacement or titration depends upon which hospital you go to. So which regime is better? So with titration regime, so you need less tablets and less dose of antithyroid drugs. So the lower dose of antithyroid drugs, so less side effects, and it's a simple regime. And it is thought that the block and replacement results in more stable thyroid function, but this hasn't been confirmed. Certainly, we did a study a few years ago, about 450 patients with Graves' disease, and we couldn't confirm that the block and replacement had more stable thyroid function than titration regime. And both the regime has got similar rate of long-term remission of hypothyroidism, and there is no incidence, no difference in the incidence of thyroid eye disease. So from the thyroid eye disease point of view, I don't think there is a big difference between those 2 regimes. So just to summarize the antithyroid drugs in thyroid eye disease. So in patients with Graves' and thyroid eye disease, it is really important to rapidly normalize thyrotoxicosis. And we should try and avoid both over and under treatment. So we need to have monitoring of thyroid function tests. And you will remember that in Graves' disease, the antithyroid drugs are usually used for about 12 to 18 months. But if you have got thyroid eye disease, sometimes we use for longer duration, even 2, 3, 4 years. And lastly, I think there was a question Rebecca sent me. What about thyroidectomy? Is total thyroidectomy better for thyroid eye disease? So in general, the incidence of thyroid eye disease seems to be similar whether you use antithyroid drugs or total thyroidectomy. And as we mentioned earlier, both medical treatment and surgery leads to the reduction in TSS receptor antibodies in a similar fashion. So, and also, although there are some studies showing improvement of thyroid eye disease after total thyroidectomy, there aren't randomized controls studies, but there is one ongoing in Austria, where they are comparing antithyroid drugs and total thyroidectomy. So the jury is still out, but there are also problems with long-term levothyroxine, the total thyroidectomy with the need for long-term levothyroxine. You'll have a scar, and there's a risk of complications like damage to parathyroid and hoarseness of voice. So we need to balance the risk and benefit. So at the moment, so we would only recommend total thyroidectomy if you can't take antithyroid drugs because of the side effects. So what are the take-home messages? So first, the thyroid eye disease is most commonly associated with Graves' hyperthyroidism, but as we pointed out that it's not always. You could also have normal thyroid function or hypothyroidism. And maintaining normal thyroid function is critical for thyroid eye disease. Radioiodine increases the risk of worsening of thyroid eye disease, and you can reduce that risk by avoiding radioiodine in active thyroid eye disease, stopping smoking, and prompt treatment of hypothyroidism. And most people with thyroid eye disease will be treated with antithyroid drugs, and often for longer than 12 to 18 months. I think that's all. Thank you.
Thanks very much, Bijay. So if you could stop sharing your screen so that we can see everybody else, then we can go to see if there's any questions. Thanks. Okay, so any questions for Bijay? Anything about anything that he's just said about how the thyroid treatments can affect thyroid eye disease, or any questions you've got about things you've experienced with your thyroid treatments?
Oh. Hi, Rebecca. My name's Nessa.
Hi.
Can you hear me?
Yes.
Yeah. I was diagnosed with Graves back in 1999, and I stayed on carbimazole until I had a complete thyroidectomy in September 2019. I was one of the few people that stayed on carbimazole for nearly 20 years.
Wow.
But it was only because I developed a goiter. And it was years before I was referred to Moorfields. I have got thyroid eye disease. And my question to the doctor is, now that I'm taking, and have been for the last year, 125 of levothyroxine, so long as my thyroid levels, my thyroid hormone levels stay stable, is there any reason why my thyroid eye disease might get worse?
Yeah, I think that is a good question, and I think there are a few interesting things. And the one is that you have been on antithyroid for a long period, and that is what studies have shown is that is absolutely safe, um, and that's absolutely fine. So um, the other important thing is that the thyroid function and the thyroid eye disease uh, uh, doesn't always go in the parallel way. So in other words,